So this is the part of the integumentary system. Here we are mainly going to cover the burns and the graft. So let us begin with slide 1. So in this particular part, we are going to cover mainly the skin replacement surgery, which mainly include the flaps, graft and skin substitute graft. Now the skin replacement surgery mainly consists of the two steps. One is the skin preparation, that is the step 1, and the step 2 is the topical placement of the graft. So let's go deep into that. So these are the guidelines that you will see in your book, where there is a definition of the surgical preparation code, then the various grafts which are there, what is the skin substitute graft. So you can just go through all this theory that will help you to understand this particular section better. So from the previous slide, we know that the skin replacement surgery includes two steps. One is the surgical preparation and then the graft. So what is this surgical preparation? So the surgical preparation is nothing but the preparing a clean viable wound surface for the placement of an graft, flap, skin substitute graft, or for the negative pressure wound therapy. And that's why either it could be in the form of excision of an open wound, burn, eschar, debridement, or the scar, or incisional release of the scar contracture, that we do it in the skin preparation. Now what are the guidelines for the surgical preparation? See, first of all, the keyword they will use is either the generally prepared or the creation of the site. And as far as the guidelines are concerned, we can add the diameter of surgical preparation area, and in that case the diameter you can add if they are on the same anatomical site or different site of the same body group. So the body groups are important, and when the skin preparation is carried out, and after that if you put the graft, so we will always put the graft code first and followed by skin preparation code. So these are the code for the surgical preparation, and they are in the range of 15002 to 15005. There are add-on code, and remember that do not sum the wound from the different grouping of the anatomical site. Use 15002 and 15004 as appropriate for the excision and incisional release, resulting in a wound up to and including 100 square centimeter surface area. So you need to pay attention that what is the body group and how much is the area that has been covered in the skin preparation. Now the skin replacement surgery. So under that we are going to cover the graft and the flap. Now the graft are divided depending upon the material we use. Under that we have a autograft and the skin substitute graft, and skin substitute are further classified into these three categories. And then depending upon the thickness, we have the split thickness, which we in that which we cover the epidermis and part of the dermis, while the full thickness is epidermis and full dermis. Now what are the guidelines for the surgical grafting? First of all, we need to identify the type of the graft. What is the type and what is the thickness, then anatomical site and anatomical body group. Add the diameter on the same anatomical site or different site of the body group. So like the surgical preparation, we can add the graft also, as long as they are in that fair location. And now in the next slide, I will talk about the different types of the graft. So first let us learn what is autograft. Autograft is in skin graft taken from one area of patient's own body and transplanted to another site on the same individual. Since it comes from the patient, there is no risk of immune rejection. And autografts are further classified depending upon the thickness, split thickness, full thickness, cultured epidermal autograft. And if you see the code for the graft, they are self-explanatory. It is a split thickness. What is the kind? It is an autograft. Even the area, the body group is mentioned, and how much the area we can take in this particular is mentioned. And if it is more than 100 square centimeter, we have add-on code everywhere. So pay attention to that. Now come to the skin substitute graft. It is nothing but a biological or synthetic material is used to replace the skin in patient with wounds, burns or ulcer. This substitute can be a temporary or permanent and may be derived from human, animal or synthetic. And depending upon the types, we have allograft where the skin is from another human donor, while the xenograft is skin from the animal sources, while the synthetic is graft is engineered tissue substitute sometimes made from the collagen or the silicone. Skin substitutes are often used when an autograft is not an option. So these are the code for the skin replacement and the skin substitute codes, and we have the code, and we have divided into the small wound where the total wound surface area is less than 100 square centimeter, and then we have the larger wound where the total area is 100 square centimeter, and we have roughly 4 codes, and in that these codes are divided depending upon the anatomical location. So we have one primary code and the add-on code, and as this is one group, and then there is another primary code and the add-on code, and this is for the smaller wounds, and similarly we have it for the larger wound. So same primary code and the add-on codes and the anatomical location. So the iron worker was working on the structure of a new skyscraper. While using a blowtorch to mold the rubber in position, he accidentally dropped the torch, engulfing his lower extremities. His co-worker immediately extinguished the flame. The patient was taken via life flight to the hospital, and upon examination, the ED physician determined that the patient will require a skin graft on both of his legs and the feet. The left leg required a 40 square centimeter full thickness graft, and the right leg required a 40 square centimeter split thickness graft. Both the feet required a 10 square centimeter full thickness graft each. The skin was harvested from the patient trunk and the buttocks to cover all the wound. The surgical site of both the legs and the feet were prepared by the assistant surgeon. Which procedure code best describe this encounter? So, since it's a graft question, we remember the first guideline is whenever there is a skin preparation and the graft, we always put the graft code first followed by the skin preparation, and we know these are the code for the skin preparation. So this code cannot be in the first place, there has to be a graft code in the first place. So we will eliminate the first option A without even going into the detail of that. Now we check the remaining code. Now here in this particular case, what has happened is there are full thickness graft, the split thickness graft, but they are autograft because the patient own skin was taken from his trunk. So we have the many clue that the full thickness graft is there, split thickness graft is there, autograft. So we will take all this information, and again the area that has been covered, that is on one leg it is 40, the another leg is 40, and the feet are 10 each. So we have enough data to zero down our answer. So after taking all our data, the answer B is the correct answer, because 15220, it talks about the full thickness autograft, and that is mainly for the right leg. The R area is 40 square centimeter, and if you see the code 15220, it talks about the full thickness graft. The area is also given, but it covers only 20 square centimeter. So we will require the add-on code there. Then we have another full thickness which is for the left foot and the right foot, that is 10 each. But we can add the graft diameter if they are in the same body group or the same anatomical site. Here the anatomical site is not same, but the body group is same, and that's why we are adding, and for that we are picking up the code 15240 full thickness graft. Here the body group is different, and that's why the code is different. And then we have a split thickness, that is a 40 square centimeter, and for that we are picking up the code 15100. This only covers the graft. Now we have done the skin preparation also, for which we have the code 1500 4 that is for the feet, and 15002 is for the legs. Remember, the feet and the legs, they are into different body group. This is a very important understanding one must have. And then we are putting the modifier 80 because it is the assistant surgeon. Now let us take one more example. The Susan, a 16-year-old, was trapped in a car when it caught fire. They were able to get to her out quickly, but she sustained a significant burns on her right arm as well as the right hand and the thumb. She was taken to the burn unit where they determined that she had a third-degree burn on her right arm, hands 25 square centimeter and thumb 2 square centimeter. The surgical assistant surgically prepared the wound, and the bovine dermal matrix full thickness skin graft was grafted to prepare the burn and secured in a place. What CPT code? Again, this is an example of the graft, but what is the kind of graft? It is a bovine dermal matrix full thickness. So this is a skin substitute graft, and then we need to find out the skin preparation has been done. Yes, it has been prepared, and we have the area also with us. So let us take all the data that we have, and then we can zero down our answer. So let us put our data to get the correct answer. Right arm has 100 square centimeter. So application of the skin substitute, because it is a bovine dermal matrix graft, and here the body area is arm. So I will require the code 15273. And how much it covers? It covers uh, equal to 100 square centimeter. Area greater than or equal to 100 square centimeter, first 100 square centimeter. So right arm is taken care by the code 15273. Now we have hand and thumb. So for that we will come to the another body group area, because this body group area is doesn't talks about hand and thumb. So we will come to this 15275. It talks application of the skin substitute graft to face, scalp, eyelid, mouth, neck, ears, orbit, genitalia, hands. Okay, hand is covered, and multiple digits. The multiple digits are covered. So we will require a code 15275. So let's see what's our answer. So if you see, it is the 27 square centimeter. 15275 covers only 25. So I'm going to require the code 15276 for the that additional 2 square centimeter. So I will require 273, then 275, 276. These are the three code I'll definitely require. Here it is covering only the 25 square centimeter hand, but the 2 square centimeter thumb is not there. And here they are directly talking about 15277. That is not the code that I will require here. So C is the correct answer, and this is the skin preparation code, and they has to be written in the second place after the graft code. So after putting all my guidelines, C is the correct answer. Now the next important topic is flap. Now one must understand the difference between the flap and the graft. Flap is a piece of the skin or the tissue that move to cover a wound while keeping its blood supply intact. And the flap is usually attached to its original site at one end and remain connected to the blood vessel. While the graft is a piece of the skin or the tissue that completely detached from its original site and move to cover the wound. So that's the basic difference between the flap and the graft. So what are the basic guidelines? One is the coder needs to identify the difference between the pedicle flap, pedicle flap and the graft. Then there is a formation delay and the transfer. These are the important thing, and then the anatomical sign. So now these are the flap codes, and these are the two important guidelines. The region listed refer to the recipient area when the flap is being attached in a transfer or a final site, and the region listed refer to a donor site when a tube is formed for a later transfer, or when a delay of a flap occurs prior to transfer. So in that case, the code 15733 and 738 are described by the donor site of the muscle, myocutaneous tissue, or the fasciocutaneous flap. So these are the important code where the site which is we are talking about, they are the donor site. So this is very important guideline here. So these are the code in your book and which talks about the formation, delay and transfer. So pay attention to those words because that will define your code. So 29-year-old flight attendant was airlifted emergently to a skin repair specialty hospital after sustaining significant injuries to her face after an automobile accident. The patient injuries involved excessive loss of tissue of the left cheek, which include the skin through the fascia and the muscle. The physician decided to take the viable tissue from her abdomen to repair the defect. To create a graft, the physician had to generate enough viable myocutaneous tissue with a blood supply. To achieve this, the doctor sutured the patient's wrist to her abdomen. The site was then manipulated daily until for the period of 2 months until the enough skin and the myocutaneous tissue with a blood supply was available for successful excision and transfer to the left cheek. The patient returned to the OR where the newly created tissue along with the blood supply was resected from the graft area and then carefully applied to the defect. The flap was secured in a place with a suture and the donor area was closed in a layer fashion. What procedure code best describe the encounter? Now we have the various code. So what has happened here is there is a cheek area where the injury was there and they have done the they have taken the flap. Why flap? Because the blood supply to the graft was intact, or they allowed that blood supply to develop, then it becomes a flap. And from where they have taken it, they have taken it from the trunk and then they have transferred it to the cheek. So these are the important thing for us to zero down our code. So let us see what our answer. So B is the correct answer because 15570, it talks about the formation as well as the transfer. So that will be the first code, and 15600, it talks about the delay of the flap or sectioning of the flap and at the trunk. So we will require this code for the delay, and this covers formation as well as the transfer. So we will write answer B, and modifier 58 is because this procedure has been carried out into 2 stages and this stages is has been pre-planned. So for that we will require a modifier 58. Now the next heading is other procedure. Under that there are various procedure that they have described. One is dermabrasion, which is nothing but the skin resurfacing procedure that uses rapidly rotating device to sand outer layer of the skin. And they have been asking this definition, that's why I have quoted here. Beside that, there is abrasion, then there is a chemical peeling, then there is the cervicoplasty and the blepharoplasty. So I'll be talking in detail about the blepharoplasty because they have asked many questions on this. Now, blepharoplasty is known as the eyelid surgery. It is a cosmetic procedure that improves the appearance of the eyelid and eye area. Basically, it corrects the defect, deformities, and disfiguration of the eyelid. It can improve the appearance of the drooping eyelid, bags under the eyes, and excess of fat. So you can see here, and sometimes the bags here, and because of that, sometimes your vision is also impaired. And if you see, these are the code for the blepharoplasty. We have the code for the lower eyelid and upper eyelid. And of course, if there is an extensive herniated fat pad that has been removed or with excessive skin weighing down lid, so depending upon that, we code it. And remember, all these codes are, they do not, use the language unilateral and bilateral. So if we have carried out the procedure bilaterally, we will have to use the modifier 50. So 76-year-old has a dermatochalasis on bilateral upper eyelid. The blepharoplasty will be performed on the eyelids. The lower incision line was marked at approximately 5 mm above the lid margin along the crease. Then using the pinch test with the forceps, the amount of the skin to be resected was determined and marked. An elliptical incision was performed on the left eyelid and the skin was excised. In a similar fashion, the left procedure was performed on the right eye. The wound were closed with suture, the correct CPT code. So let us eliminate the absolute wrong option first. and 15820 is the wrong option. Why? Because it is a blepharoplasty on the lower eyelid. In our case, it is a upper eyelid. So this is the absolute wrong option that I will eliminate. Now it is left with the three options. In our patient, we have not, in the case documentation, there is no mention of the excessive skin weighing down the lid. So, 15823 is not the correct option, and that will help me to eliminate option A and option B. And they have just talked about a bilateral upper eyelid blepharoplasty. So that is 15822, and since it is carried out bilaterally, we have the guideline for the bilateral blepharoplasty, add modifier 50. So I'll be adding the modifier 50, and that's why C is the correct option. This is my last slide, and we will cover the remaining guidelines in the next part.